know that HIV is preventable. Yet the rates of HIV infections remain high in Canada and in other countries. Providing individuals with access to testing, treatment, and care can help reverse this trend. Removing barriers is the key to ending the AIDS pandemic. Through the pandemic, we've heard to innovate to reach people and connecting them to care. Now we are taking the lessons from this other pandemic and applying them to our own AIDS efforts. For example, Canada's National Microbiology Laboratory has been working closely with Indigenous communities in northern, remote, and isolated settings to equip them with the tools and training they need to be able to perform testing for infectious diseases. This has enabled a culturally responsive, community-led and community-based response to healthcare in those communities, empowering them to determine their own path forward. And that holds so much potential for the HIV response. In Canada, we know that removing the barriers to care and ensuring everyone has equal access to HIV prevention, care, and support is key to reaching our shared goals of 95, 95, 95 by 2025, and ultimately ending HIV as a public health concern by 2030. It gives me hope to think of how far we have come. Today, HIV is a manageable condition when diagnosed and treated early. And with the evidence showing that antiretroviral treatment can prevent transmission to other people, there is even more reason to be optimistic. We have made real progress over the past 3 decades, and we won't stop now. One pandemic cannot overshadow another. Yes, we've come a long way since the 1980s, but we know that much more needs to be done. I hear you. The entire government of Canada hears you. I hear your anger and anxiety, and I also hear your hope. Hope that we can do better if we work together. That hope and hard work is what we want to focus on. Together, let us re-engage, follow the science, and carve the path towards a world without HIV/AIDS.
Ensuring that more Canadians know their HIV status is one of the most important actions we can take to end Canada's HIV epidemic. When someone knows their HIV status, they can access treatment, and they can achieve an undetectable viral load, meaning they cannot pass on HIV to their partners, eliminating the risk of onward transmission and stopping HIV in its tracks. Undetectable equals untransmittable. I view this as a first step. I'm encouraged by this. This is great. An investment in HIV testing will certainly help us get these test kits in the hands of people that need them, but we're hoping that this is an open door policy and that there'll be more conversations in the future around exactly how we want to spend that $20 million. Testing was one of those things. We want to be able to look at things like prevention, treatment, care. So Mr. Duclos will be calling.